I am Dr. Manish Chhabria, consultant neurologist at Sir H.N. Reliance Foundation Hospital in Mumbai. Today we are going to talk something about epilepsy. Epilepsy, this is a very important disease, and we are discussing this on the occasion of Purple Day, which is March 26th, recognized as to be discussed for epilepsy. Epilepsy is a very common disorder. 12 million people in India have epilepsy, which is 0.5 to 1% of the population. In common terms, it is called mirgi, daura, khench, fits. These terms are very commonly used by the common public when they refer to the epilepsy. We should know what this disease is. It's a common neurological problem. We see day to day this problem in our practice. What happens in epilepsy? Epilepsy, it's a constellation. It's a series of seizures which the patient presents. What happens in the brain to cause epilepsy? In epilepsy or in seizures, there is an abnormal electrical discharge in the brain which causes excessive bodily movements, or the patient loses consciousness. What is a seizure? You will ask, what is a seizure then? Seizure is a single episode where there is an abnormal discharge. But when you get recurrent seizures, it is called epilepsy. Why you should know something about epilepsy? Because you see it at all ages. The commonest age group where you see is in children and in elderly patients. But anybody can get epilepsy. At any age you can get epilepsy. And some brains over the time we have seen are more sensitive to cause seizures or epilepsy or fits. What causes epilepsy? Epilepsy can be due to genetic causes. That means there is an inbuilt gene defect which you see commonly in young people or children. Or the commonest things which you see are tumor in the brain, a stroke, or an infection like a worm infection, tuberculosis, very common in India, and many other reasons to cause epilepsy. What you should do? How will the patient recognize that he has epilepsy? He will have abnormal bodily movements. Either the entire body will jerk and the patient will lose consciousness, or one part of the body will jerk. When one part of the body jerks, it is called focal seizures. And in that, the patient may or may not lose consciousness. In that, only one part of the brain is firing inappropriately, or there are excessive discharges in the brain. But when the entire body jerks, which is called generalized seizures or generalized tonic-clonic seizures, the entire brain there are abnormal discharges. After this generalized seizure, the patient may lose consciousness. And then after that, he regains consciousness, which is called a post-seizure or a post-ictal phenomena. In some patients, we see that a patient may get an abnormal feeling from inside, which is called an aura, that he will know that this seizure is coming. Why it is important to know for the aura? Because you can recognize the seizure early, or you can abort it by giving medications, and the intensity of the seizure can be subsided. And aura also means that there are specific areas on the brain from where these seizures are coming. When a seizure comes, what you should instruct the family as a first aid, or to document or record the episode when they are consulting the neurologist. What is the first aid? I will talk about the first aid first. Whenever the seizure comes, nobody should panic. The family members or the bystanders should not panic. Most of the seizures stop on their own. Within 2 minutes, 90 to 95% of the seizures stop. Even if the patient's body is jerking, don't force the hand or leg down, because in that way you may cause an injury. Loosen the tie, loosen anything, tight clothing, allow the patient to breathe. Don't overcrowd on the patient. Turn the patient to one side so that the saliva, blood, or whatever is coming in the mouth can be brought out and the airway remains clear. Time the seizure. We should know how much time the seizure lasted. Don't put anything in the mouth. Don't put your finger in the mouth. Don't put your spoon in the mouth, because in that way you are causing more harm to the patient. The teeth may break, the tooth may go inside the patient's airway, or the patient may bite your finger because there is a clenching of the teeth, or the jaw becomes tight. So don't do all these measures. In India, we see many people give onion to smell, or they give a slipper to smell, thinking that this will stop the seizure, but it usually doesn't happen. There is no scientific basis behind giving onion or making the patient smell all these vague things. After the seizure subsides, call for help, or give some emergency medication if there is anything written in the patient's pocket or the doctor has prescribed. Once the seizure subsides, then call the doctor or call for the help. The other thing is, don't overcrowd, as I already said, because that may cause lack of oxygenation. All these are very important first aid measures. Yes, the other one important thing which I want to mention is, If the patient has fallen on the floor and his head is jerking, keep some cushion below the head, otherwise he'll get a head injury. Take the patient to a safe environment as soon as the jerking stops. So all these first aid is very, very important. If possible, one should video the seizure in patients who have recurrent seizures, or when you go to the doctor and the doctor doesn't feel that you have a seizure or it's not a true seizure. A video clip may help the neurologist to know that it's a seizure. So this is how you diagnose a seizure. Once you have diagnosed, how will you investigate once the patient lands up in the clinic or in the hospital? You have to take a detailed history, detailed account of how the event happened, do a thorough neurological examination, do some investigations like an EEG, how you do ECG for the heart. There is an EEG for the brain which tells you the recording, whether the seizure activity is coming from which part, whether the seizure has stopped or not stopped. After you do the EEG, some patients may require a scan, especially if it's a first seizure in life. In the scan, what do you look for? As I already mentioned, tumor, stroke, neurocysticercosis infection, which is a worm infection which is very commonly seen in India because we don't eat hygienic food, we eat food on the roadside. This worm goes inside the stomach and travels to the brain, causes swelling there and causes a seizure. So all these can be looked into the scan, because along with the fits medicine, along with the epilepsy medicine, you need to treat these other reasons also, because if you don't treat them, you will get recurrent seizures. So these are treatable causes of seizures. After that, you do some basic blood checkups like calcium, sodium, WBC count, because infection, as I mentioned, any chemical fluctuation in the body can disturb the brain milieu and cause these seizures. Once it is confirmed that this patient has seizures, you need to put him on some medications. Older medications had their own problems, but they were very, very efficient. Most of the older medicines are still used in practice and they are very, very efficient. The newer medicines which have come up are less problematic. They have less side effects, they are more efficient, the dosing also has become less. So in that way, based on the patient profile, age, what comorbidities the patient has, you can decide what treatment has to be given, which medication has to be chosen. Some things which I want to mention is some special populations of our patients who get seizures, like women with epilepsy. It's a very, very common problem. Everybody keeps on asking whether a person can get married, whether they can have children with epilepsy. Yes, epilepsy is treatable and curable, and a person with epilepsy can get married. For a male, there is no problem. Any fits medicine will do. But for a female, you have to be very, very careful, because you have to think of the future childbearing for the future child, because the medicine should not have bad effects on the child in utero when the patient is pregnant, or thereafter when the patient is breastfeeding. So in these cases, there are certain medications which are pregnancy safe. So you have to choose those appropriate medicines. And the dictum and the rule is you have to use the least dose of the drug, the lesser number of the medicines, so that the problems for the child and for the mother are not there. Besides that, elderly patients also get epilepsy. In those cases, you have to look if the patient has hypertension, if the patient is on multiple medications, if the patient has liver problems, kidney problems, and in that case, you have to decide the medication appropriately. So overall and above, I would say epilepsy is treatable. It is not a scare. It is not a big dictum on the family. So epilepsy can be cured. Epilepsy is treatable. The important thing is to recognize the epilepsy, investigate thoroughly, plan the appropriate treatment so that the patient can lead a normal life. And one more thing which I want to add is, one common question which comes to us is what precautions to be taken. So epilepsy patients, what precautions to be taken is swimming, driving alone, all these have not to be done. There should be somebody, because you are putting yourself at risk and somebody else also at risk, because they may get a seizure during driving. But besides these few precautions which are said, an epilepsy patient can lead a normal life. Thank you very much.